There's international consensus that planned Vbac is a clinically safe choice for the majority of moms with a single previous lower segment caesarean birth. Your clients may be hearing some conflicting statistics. The most frequently referenced statistics are that of her risk of scar separation or uterine rupture is 0.5% or 5 in 1,000 or 1 in 200 depending on the research. But to look at it from another perspective, and as always with gentle birth we're focusing on best case scenario, she has over a 99% chance of having a normal healthy birth. These are really good odds. If mom chooses a repeat caesarean, she has about a 99% chance of not having a scar separation and a 100% chance of major surgery and all of the complications that come along with that surgery. From 1976 to 2005, 19 peer-reviewed studies on uterine rupture reported 1,654 cases of uterine rupture among over 2 million pregnant moms. The overall rupture rate was 1 in 1,514 pregnancies. That's 0.07%. Now, according to Canadian obstetrician Andrew Kotaska, we live in a culture of risk magnification. We tend to focus on the small, unlikely risk rather than the bigger picture that with appropriate care, in all likelihood, mom will go on to have a wonderful Vbac and things will go perfectly well. So what are some of the benefits of Vbac? Well, mom will avoid the risks associated with repeat caesarean and have a quicker recovery time. Her baby is less likely to have trouble breathing after he's born compared with a baby born by planned caesarean. Mom will usually have a shorter stay in hospital and less pain in the weeks and months after the birth. So how can mom stack the odds in her favour of having a successful Vbac? Well, first off, choosing a truly supportive Vbac care provider, someone who has a high rate of Vbac and believes in Vbac, starting labour spontaneously and avoiding induction unless medically indicated. We'd encourage moms and their partners to consider debriefing their previous experiences. This is really helpful for birth partners too. Consider hiring a doula and consider avoiding the epidural if possible due to the associated risks that come with the epidural. As a gentle birth instructor, we encourage moms to discuss their options for Vbac with their care provider and how their labour will be managed so they can stack the odds in their favour of having a positive experience. Vbac is a big topic and it's one that we'll cover in much more detail in our upcoming Gentle Birth Vbac class instructor training.